Hi, this is Ashley from Rochester Regional Health, and I'm here today with Dr. O'Haron to talk to you a little bit about lung cancer screening. Thank you so much for joining us.
You're welcome.
Now, you may know about the importance of early detection when it comes to other cancers, such as breast or prostate, but it's just as important when it comes to lung cancer, especially if you're a high-risk patient. How would you describe a high-risk patient?
Somebody who's generally over the age of 55 and has a significant smoking history, and we do calculations to figure out whether they qualify for lung cancer screening.
All right. I can see where this would provide a lot of peace of mind to somebody who's been smoking for quite some time and may be worried about getting lung cancer, but it can also be very stressful. You don't know if you have a long road ahead of you if you are diagnosed, and even the day of the exam could probably be very stressful, especially if you don't know what to expect. What is the exam like?
It's very simple. Actually, the patients come in, they change into a gown, and then we bring them into our CAT scanner, and the exam actually takes less than 5 minutes to perform.
Well, since it does take such a short period of time, maybe we can show everyone a little bit of how it's done.
Sounds good.
Excellent. For the purposes of this demonstration, we asked one of our colleagues, Nicole, to act as our patient. Now, she won't actually be scanned today, but you'll be able to see a little of what happens when you come in to be screened.
We first ask our patients to change into a gown in one of our dressing rooms. Then they are led back by a tech who will show them how to lay down on the CT scanner.
Now, I noticed that this isn't really enclosed. Will the scanner at any point go over her head like an MRI?
The patient is never enclosed in the CT scanner. In fact, many of our patients who have a hard time with enclosed spaces find this a much easier process. The bed simply moves into place and instructs the patient to take a couple of deep breaths. The scanner then rotates around the patient's upper torso, taking multiple images which are then put together by the computer to give us a 3D image that looks very similar to this.
That's incredible. And when you get the image, what exactly are you looking for?
Well, a radiologist will actually look through the images, and we're looking for any pulmonary nodules or masses or any abnormalities in the lungs.
And how quickly can a patient expect to hear the results?
Usually within a couple of days.
Well, that's good, because then you can get a little bit of peace of mind quickly, or you can start to work on those next steps if you need to.
Absolutely. Early detection is key, and it really can have an effect on patient treatment and prognosis, and we recommend this test annually.
Well, thank you so much for your time today and showing us a little bit more about what a lung cancer screening is really like.
You're welcome.
And thank you everyone for watching. We hope we answered a few of your questions. If you do want more information, please visit us at rochesterregionalhealth.org or give us a call. We're always happy to help.